So now I'm excited to welcome back our ataxia expert, Dr. Susan Perlman. Dr. Perlman is a clinical professor of neurology and director of the Ataxia Center at the UCLA Medical Center in Los Angeles, California. Welcome, Dr. Perlman.
Hello, hello. Thank you so much for inviting me back. This is an opportunity for me to have what are effectively clinic visits with individuals, as you said, across the country and across the world, since much of what I do during a clinic visit is answer questions. People with ataxia have, some information. They may need more information about a particular topic. They may have heard something that they want to confirm. So, I think this is an opportunity for me to interact with, we're up to 175 individuals, many of whom I think will have questions that will be enlightening for all of us. So let me start with Efrat, a question regarding spinocerebellar ataxia type 3, about advanced research and clinical trials that are currently being conducted in the world. Now, for all the good basic research that is going on in all of the genetic ataxias, clinical trial activity is relatively quiet. SCA3 being the most common of the dominantly inherited ataxias seems to have the biggest pipeline. And if you've been to the National Ataxia Foundation website, you'll see the pipeline of basic science and translational research going on, trying to bring promising new drugs into the clinical arena. But in the United States, there were two active studies. One was the Biogen study of the gene blocker, as it were, to prevent the production of the abnormal protein. And that study was stopped primarily for safety concerns. They didn't have safety issues with people that were already enrolled in the beginning of the study, but they anticipated from animal work that they had done that to attempt to raise the dose to a more effective level could risk significant side effects. So that has gone back to the drawing board. However, Selos, with their intravenous trehalose to break up the abnormal protein that's accumulating, had begun recruiting. It's on pause right now, but in the fall, it will open up again for recruitment. There's on clinicaltrials.gov a couple of other research groups that are running clinical trials for ataxia type 3. One is in Malaysia, where they have an oral formulation of trehalose. One is in Taiwan, where they're working with stem cells to stimulate nerve growth factors and stimulate nerve connectivity and protect nerves. And in Europe, the Vico company has a drug similar to what Biogen was working with to prevent the production of the bad protein, from the genetic level. And that is still running, and we'll see where that goes. So as slow as things seem to go, there is more and more interest every year in the basic science and translational science groups. Now, Michelle has a question about RFC1 or Canvas that she has been diagnosed with. Do the expansions increase as the disease progresses? No, the expansions do not increase. They stay as they are, altering the behavior of that important gene and causing disease progression, but the mutation is the same. Now, Stephanie, has something to add, I think. Do I see that Stephanie wanted to answer something to do with Canvas?
No, I'm just marking off the questions as you answer
Okay,
them.
All right, good. But Canvas is an active area of research with clinical trials hopefully being planned. as is the new dominant gene 27B, which has turned out to be more common than would be expected of the rarer dominant ataxias. And that also has an active natural history and potential clinical trial program that is being developed with the help of the National Ataxia Foundation. So we are, fortunate that NAF is fully behind much of the up and coming research that's going on. Now, John has a question about a working diagnosis of idiopathic late onset cerebellar ataxia, ILOCA. For years now, when the sun begins to set, I become very uncomfortable. Muscle tightness, pain, difficulty thinking, decreased coordination, balance, walking, speed of thinking, and emotional well-being also degrade. And he says it's as if he, had a shot of alcohol starting around sunset and into the evening hours. I just had somebody else mention that, and they referred to it as sundowning, which isn't really correct. Sundowning occurs in the evening hours for individuals with dementia, where whatever goes on when the sun goes down and exposure to sunlight is diminished, the end of the day, people are tired. With dementia, they tend to become worse. The motor functions that you describe getting worse probably relate to use of the muscles in the face of ataxia. If you have, active days where you're moving around doing things, your muscles are working twice as hard because of the ataxia. And by the end of the day, if you haven't broken up your day with rest periods or times where you alternate sitting and more vigorous activities, you are going to end up more fatigued, more tired, more muscle pain and tightness. On the other hand, if we actually have muscle involvement, and some of the ataxias affect the balance center, but they also affect muscle, then just muscle use on top of a muscle that might be compromised. So the fact that you have an idiopathic, it hasn't been identified yet, I wouldn't give up the search for an underlying cause, and maybe have your doctor look at muscle testing, electrical muscle testing, or testing for muscle products that could indicate muscle stress. And that could, indicate a muscle component to your ataxia, which would be managed in a different way from the general ataxia. But in the meanwhile, I would suggest breaking up your daytime activities. And there are medications that can help with the symptoms that you have noted. Peter has a question: what types of ataxia may be linked to essential tremor? He's had familial essential tremor for many years. 5 years ago, he had deep brain stimulation, targeting the VIM thalamus, for essential tremor, but afterwards began to notice signs of ataxia. Now, as he points out, deep brain stimulation can have a side effect of causing ataxia. It can also have a side effect of altering speed of memory and thinking. So, I see that he did have his stimulator turned off for a year because of the ataxia. And I'm wondering if, number one, turning off the stimulator allowed any of the ataxia-related symptoms to improve, implying that they were from the stimulator directly, or if indeed you do have a condition that may begin with essential type tremor and then evolve into ataxia as you described. Spinocerebellar ataxia type 6 can present like that. There are other dominantly inherited ataxias that may begin with a familial tremor and then evolve into a more ataxic presentation. So I would encourage you to, explore genetic testing to see if there is a genetic factor that, might run in your family, beginning with tremor and then developing into ataxia, at least in your case. Ramiro has a question about CBD oil for ataxia. CBD and other products related to, marijuana and THC have been used for a long time, certainly in areas where their prescription or use is permitted for things like pain, spasm, stiffness, anxiety, which can amplify symptoms of ataxia. But for actual ataxia, I don't think CBD is going to be that helpful. It could be helpful for some of the other symptoms that may accompany ataxia, as I indicated, but the ataxia itself, I don't think it's going to be that helpful. And if you're using CBD that has some THC in it, could actually make you more dizzy and more ataxic. So Kathy has an interesting question that she's heard that all ataxians have problems utilizing thiamine. Now, there are some ataxias that there is a defect in the body's ability to use thiamine, to absorb thiamine, and those would be treated, with thiamine replacement at various levels. The areas of the cerebellum and the brain that use thiamine as part of their normal activity, if you have a defect in that part of the brain, then you're not going to use thiamine properly, but it won't be the cause of your ataxia. Joanne has a question. She's 79, was diagnosed with SCA, spinocerebellar ataxia, type not known. In the past year, had been experiencing significant leg pain. Is this an expected symptom? Many of the ataxias are just active in the cerebellum. Pain is not an issue. It's more problems with coordination, balance, tremor. But if pathways that the cerebellum connects to have been involved, then you can get leg spasms, leg pain, leg tightness as part of the underlying condition. So if your doctor has been able to identify the cause of your leg pain, is it neuropathy? Is it tightness in the muscles? That can be symptomatically treated with medication and might lead to a better way to diagnose the underlying cause, genetic or otherwise, of your SCA. Now, there's an anonymous attendee who has asked about, can a SCA6 patient use 7,8-DHF as a drug treatment? How to take and how much daily? Well, I am not sure what 7,8-DHF is, and I'm going to write it down and look it up. And this goes on in my clinic. Somebody will bring in some information that I'm unfamiliar with, and then we'll go online together and look it up. But I think what I promised to do, and I've promised this before and probably haven't followed through 100%, I'm going to look that up and I will get back to Lori about it. And then hopefully she can connect with our anonymous person or post, a discussion of it. Amy has a question about the inability to control your body temperature, and is that related to ataxia? So the autonomic functions of the brain are based in the brainstem. So they're not part of the cerebellum. But if your cerebellar connections to the brainstem, have been affected, you could have alterations in some of these brainstem functions, which include temperature regulation, which is involved with the thalamus, the hypothalamus connections in the brainstem. Also sleep disorders and other things that we don't think of as being voluntary factors that are affected. So if you're having trouble controlling your body temperature, hopefully your doctor is ruling out other things, thyroid disease or some other hormone-related process. But some of the more complex ataxias do involve brainstem and hypothalamic and thalamic connections. Mark has a question about, looks like transcranial direct stimulation and also, transcranial magnetic stimulation, which I don't think he's mentioned, seem to help people with movement and cognitive issues. So we've already had a little discussion about deep brain stimulation for tremor, but there are stimulation techniques that are involved in research protocols around the world where they use magnetic stimulation or electrical stimulation to help with mood-related problems, to help with movement, with balance. Currently, for use other than depression, these non-invasive stimulating techniques are not being used clinically. They are being used for depression, but the use for the motor problems of ataxia is still research related. Mark indicates that he bought a device online, it's not clear what kind of device it was. But I will make a note to see if I can find out more about that as well. Iwa has a question, again, about transcranial direct current stimulation. And again, it is not available, at least in the United States, for clinical use for ataxia, but it is under research. Nancy has a question. I was taking riluzole. However, after 6 weeks, my symptoms got worse. The UC health neurologist told me to stop, and he has only 1 out of 100 patients that I guess have had this side effect. Have you seen this in your practice? Well, we know that riluzole has been looked at positively as an agent that can be used off-label for treatment of symptoms of ataxia, and it might also protect the nerves in the cerebellum. This is based on research that was done in Europe. But, a known side effect of riluzole is dizziness. So if you have dizziness as part of your ataxia, the risk it could be worse. If you've not had dizziness, then possibly the head fuzziness that you're describing and the worsening of balance could be from that side effect. And I have seen it in other patients. It's not common, but it obviously is a reason that, getting dizzy, even if it helps your ataxia, may not be a good trade-off. Now, Lei has a question about testing for the FGF14 gene, which is the gene behind Canvas, and the mutation testing is currently only available through the University of Chicago Genetic Testing Lab. I think to have your physician contact them about having a sample sent. I believe they can mail out kits, and you can send a sample of saliva, for instance, back to them. Now, another anonymous attendee, I am told that what I have is ARCA, autosomal recessive cerebellar ataxia, and it appears in this case to be related to a CoQ10 deficiency. So if you have a genetic ataxia that affects the coenzyme Q10 levels, the treatment is obviously CoQ10 replacement. There is active research going on, especially in Europe, with the autosomal recessive genetic ataxias of all types. And I think if we can follow, their messaging and publications on the Ataxia Global Initiative website, we can keep up with that. Aurora has a question. Her 7-year-old son has been diagnosed with cerebellar ataxia due to a de novo genetic mutation. So obviously I would wonder about that mutation, which mutation it is, in what gene. How will the disease progress, and what is the life expectancy for a patient with this disorder? Very, very different, depending on the gene involved. For instance, there are gene mutations in the gene for spinocerebellar ataxia type 29, as an example, which can present in childhood with an ataxia that may be stable and may not progress. And, you know, the person can actually accommodate it and develop, you know, very good coordination and balance in spite of the mutation. Some mutations that may present out of the blue, as it were, may be progressive. So we would need to know what gene it is and what the mutation was. And that's where it's going to be important for you to have those discussions with a genetic counselor or a neurogenetics person. Allison has a question about nutritional supplements. And I think, you know, for somebody with a well-balanced diet who can eat normally and isn't avoiding certain foods because of swallowing issues or digestive issues, nutritional supplements probably not necessary. If you do have a problem with swallowing, a problem with your GI tract where you can't tolerate certain foods and might be missing nutrients or micronutrients, then nutritional supplements can be helpful. If you're having problems with thinning of muscle and weakness of muscle, there are nutritional supplements that contain creatine, for instance, that can help, you know, re-strengthen muscles when used together with an exercise program. So I think it's always good, if you're thinking of starting a nutritional supplement, to discuss it with your neurologist or your general medical doctor or a dietitian or nutritional specialist, so you can choose something that's appropriate for what your needs are. Sandra has a question of, with SCA6, why do all different kinds of drugs cause depression? Now that is interesting. I think there are many drugs that can have a side effect of causing fatigue, causing, you know, low energy levels, and potentially contributing to depression. Not just with SCA6, I think with any of the SCAs, you know, many of the tremor drugs that act on the brain to reduce tremor, you know, can cause fatigue, can cause tiredness, and could trigger depression. In fact, most drugs that act on the brain, even if you don't have ataxia, you have something else, come with a warning that they could cause depression or suicidality, suicidal thoughts, because they work on brain pathways and are not completely understood. So I think that's an important thing to recognize when you're starting a new medication for tremor or for another symptom, that, you know, we recognize, you know, some drugs can cause nausea and some drugs can make us feel dizzy and some drugs can make us feel tired, but some drugs may affect your mood. And don't just write it off to your ataxia. You know, be aware if there's a sudden change in the way you feel, that it could be a new medication that you've started. And if you are feeling depressed, or, you know, a loved one or somebody, you know, with ataxia who's starting a new medicine and is feeling depressed and has talked about suicidal thoughts, definitely seek help. Now, there's a question from, I think we'll, you know, kind of, you know, go to the end of the group and work backwards. There's so many good questions here. Another one from an anonymous person. Would physiotherapy and leg strengthening specifically for ataxia help? They're doing some at home and at the gym, but the legs feel wobbly and then they have to rest and then they seem to recover. Concern about, are they overdoing? Are they causing muscle stress? The proper exercise for somebody with ataxia includes core strengthening, balance exercises of various types, and rhythmic repetitive exercise like cardio. Those are kind of the three areas that the greatest benefits for ataxia in physical therapy or home exercise are beneficial. Now, leg strengthening, targeting the leg muscles, helpful if you're having weakness in the legs. But if you notice that you work your legs out and then they feel wobbly and you have to rest, possibly you are overdoing. And if you have to rest for more than an hour, then you probably need to cut back on the strengthening, the targeted strengthening for the legs, and do something that's a little less stressful. Now, here's a question about, someone whose son had propranolol prescribed for his heart because the heart muscle had thickened. Have you seen other medications that might be more effective? Now, in individuals with ataxia and cardiomyopathy, thickening of the heart muscle, which can occur in mitochondrial disorders, Friedreich's ataxia, the ability to treat and protect the heart muscle has greatly improved over the last 20 to 30 years. Medicines are used preventatively to take stress off the heart muscle so it isn't working as hard and isn't damaging itself further in the context of those illnesses. So propranolol as a beta blocker is commonly used. It's also used if your heart involvement is causing rapid heartbeats, and it can slow the heart rate down from 120 to something that is going to be more functional for the heart. But the beta blockers like propranolol, atenolol, and others are used as a heart protector. However, ACE inhibitors, different category of drug, are also used to reduce output stress on the heart. So the heart can pump even with a thickened wall and not have too much resistance that could cause the muscles to thicken further or to become weaker. So there are other categories. So if propranolol has had side effects, which I get a sense, there may have been side effects. It can cause fatigue, is one. It can cause feelings of weakness. Then there may be other drugs in that family or the ACE family that could be used. Now, here's another question from a mom, Maria, about her little girl, age 7, with SCA7. Now, spinocerebellar ataxia type 7 is one of the dominantly inherited ataxias. It affects balance and coordination, but it can also affect vision. It typically occurs in a person's 30s, but larger mutations can cause childhood onset, as this little girl is experiencing. She is taking CoQ10 200 milligrams, which is an appropriate dose for a child. But mom notices that the disease progresses too fast, and some concern that is there something else that could be given that might slow progression or improve symptoms. The child has had symptoms for a year and a half, is now relying on a wheelchair, and has had visual loss. So I think the one drug that has had a lot of off-label use as a neuroprotector and something to help stimulate balance pathways, and I've used it in children as well, is riluzole. And I would definitely discuss that with her doctor. Also, because of the vision changes, I would hope that she's taking a vitamin supplement specifically for the eyes. There are eye vitamins that are out there that can help protect the eye at least a little bit. But I think riluzole would be a good thing to add as well. Now, here's another anonymous question about Serodist, which is approved in Japan for the treatment of ataxia, not just spinocerebellar ataxias, but a variety of ataxias. The studies that were published, didn't look at a specific SCA, but looked at, like I said, a variety of ataxias. And it does appear to be helpful, whether it's genetic or non-genetic ataxia, but you can only get it in Japan prescribed by a Japanese doctor in person, so that patients who have gotten it, have traveled to Japan, have seen a doctor there, and have gotten enough medication to last them until their next planned visit. So, the question is this something that we're planning on testing in the United States, for instance, or in other parts of the world under the FDA, which would make it more widely available? And I know that's been under discussion for a long time now, and I don't know where that discussion is going. So Carl has a question about treating spinocerebellar ataxia type 1 with off-label use of color soda 1. Not sure what that is, in combination with, I think that this is probably something looking at the cerebellar channels that cause cell death. So we're looking at the pathways that lead to, premature cell death, excitotoxicity. But I think color soda 1 and back oven is a case of either a translation problem or your computer is using a spell correction, which is totally wrong. So if you can, put your question in again, because I haven't heard of those terms. Gail has a question about dizziness, a very difficult symptom to manage. If it's coming from inner ear connectivity, sometimes medications used for the inner ear, Meniere's disease, for instance, can be helpful. Things like, and there's a list of them on the National Ataxia Foundation website. They have a list of, medications that have been used for dizziness and for other symptoms. So, meclizine, bonine, and some things that, can be tried over the counter or by prescription. For prescription drugs that have maybe some broader research in use in ataxia and dizziness associated with ataxia, there's dalfampridine, which is now available as a generic for, off-label use for things other than multiple sclerosis. It may be helpful for dizziness. But in addition, if your dizziness is coming from abnormal eye movements, nystagmus, there are a variety of medications that can be used to calm down the eye movements, which could contribute to dizziness. And again, many of those are listed on the National Ataxia Foundation drug treatment website. Now, Ro has a question. I have things like dragging my right foot, shortness of breath, double vision. Is this normal in ataxia? Double vision is commonly seen in ataxia. Shortness of breath is uncommon unless you've had some incoordination of the muscles of breathing, and then, you're not coordinating a breath properly and you're going to feel short of breath, but it should absolutely be checked out by your general doctor or a pulmonary specialist. Just because you have ataxia doesn't mean you're immune to other conditions. Dragging your right foot or dragging any foot could again relate to the ataxia and coordination, of foot stepping. But again, you want to make sure it's not related to an orthopedic issue or a pinched nerve. Then Sylvia has a question about GAD65 autoimmune disease, how to cure. And it looks like plasma didn't help. And I don't know if you're referring to plasmapheresis, which is a plasma filtering technique where they take blood out of one arm, run it through a filter that filters out the antibodies, including the GAD65 antibodies, and then puts the rest of the blood back in the other arm. So if it was plasmapheresis that didn't help, I think the next thing to try would be intravenous immunoglobulin. If you're referring to plasma and it's actually intravenous immunoglobulin that didn't help, then you can look at plasmapheresis, and there are drugs that are used to suppress the production of antibodies. Are used in chemotherapy, but can be used, if carefully monitored, to suppress the production of these bad antibodies as well. Now, in a small percentage of people with GAD65 antibodies, there is a small hidden cancer somewhere, usually in the chest, that could be causing those antibodies to be produced. So all of my patients who have GAD65 antibodies, I encourage them to have an evaluation imaging to look for possibly a small hidden cancer that could be causing the production of the bad antibodies. You then treat the cancer and the bad antibodies will stop being produced. So, definitely, continue to work hard on getting proper treatment for that. Then, next question. Let's see. Okay, so we're back with the spell check. All right. So one of the agents that Carl had asked about was chlorzoxazone. And I'm going to scroll back. I know there has been some interest in chlorzoxazone by the other, ataxia researchers as possibly having a neuroprotective effect, but it would need to be used under careful supervision. I've only tried it in a couple of patients and I haven't been impressed, but I know other clinicians in the the National Ataxia Foundation network, do use it. And then Celia says it was plasmapheresis that had been tried. And so I think the next thing I would try would be IVIG for the GAD65 and also a good workup for an underlying, cancer or tumor. Now, Ernest has, a question. I have SCA5 and both my adult children do. I'm told that my grandchildren have a 50% chance of having it. Yes, that is true. If they don't inherit the bad gene, then your great-grandchildren will have no risk. So, working with a genetic counselor, with genetic testing, what the gene is in the family. And so it's going to be easy to screen, at-risk individuals, for the presence of that gene. Okay, now here, Howard, hello. Dr. Ogu just prescribed dalfampridine. What do I think? Good idea. Of the two drugs that are recognized by the American Academy of Neurology as having use off-label for ataxia, one is riluzole and one is dalfampridine. So I would say give it a try. Both riluzole and dalfampridine, now that they're generic, can be gotten often with coupons from GoodRx, for instance, for a relatively inexpensive copay, or a very affordable cost if your insurance doesn't cover it. Now, another anonymous individual is trying PTNS, percutaneous tibial nerve stimulation, and this is apparently through their urologist. I have heard of it being used. It's these types of stimulation techniques, similar to acupuncture, electroacupuncture, the percutaneous tibial nerve stimulation, are felt to have central effects. So I think it's very reasonable to pursue under the guidance of your urologist. Then Rana has a question about her symptoms of ataxia type 34. Feels that her symptoms are getting worse. And indeed, it is very rare. I mean, indicated that there may be 6 people in the world that have it. There may be a few more. But again, worried about what she should do. Certainly symptomatic treatment. And, we can, go ahead and look up, SCA34 if we wanted to do that right now. Look at the types of symptoms and the parts of the nervous system and cerebellum that are involved, and then see about symptomatic management. So research is going on even for the rare ataxias. And I would recommend, going through your local neurologist looking up people who have published about ataxia type 34 and then communicating with them, because most likely if they've published in the medical literature, they are the ones that were involved in discovering it or the ones that are still doing research on it. They may want you to send a blood sample to them. So, number one, look at symptomatic treatments and physical therapy. Number two, connect with the people who made that gene discovery and see what you can contribute to further research for that very rare condition. Vina has a question about lion's mane for ataxia type 1. A lot of people are using it for all kinds of ataxia. I think lion's mane seems to have reasonably good accounts from people using it, that they feel better on it. They feel more coordinated. They feel more energized. It seems to be safe. So any herbal supplement like this, or any supplement that you want to try, I would say try it for 3 months. If you don't notice a difference, then it's not going to work for you. But lion's mane seems to be a reasonable one that we've drawn from the Eastern herbal tradition. Now, Carmen, her daughter is taking Azilect, rasagiline, and it seemed to help her tremors and swallowing. She has cerebellar ataxia. Now, Azilect or rasagiline works through pathways that are involved in the basal ganglia, which is the part of the brain that is involved with Parkinson's. We know that the cerebellum communicates with the basal ganglia. And some of the tremors in ataxia are because of that connection or disconnection. So drugs like Azilect, drugs like Sinemet, carbidopa, levodopa may help tremors in the ataxic person if they're targeting that particular pathway. Now, another anonymous person, I'm a 66-year-old male who through gene testing with his sister was found to have Niemann-Pick C type 1. He's on a clinical trial, going to Fairfax, Virginia every 2 weeks for an infusion of this agent, cyclodextrin. Had the 17th infusion yesterday. And question is, how long should he expect to see any change? I have no experience with this treatment. I know that there is active research going on with Niemann-Pick type C, type 1. But I think in my career, I've only seen 2 people who have been diagnosed with it. And this was before this research treatment was involved. So you feel that by your 17th infusion, which if you're getting it every 2 weeks, then it's probably, if I can do math in my head, you've probably been doing this for 8 or 9 months, I would think. And you would hope to see some benefits by 6 months if it's disease modifying, if it's modifying, the impact of that gene mutation. But the study is going for 2 years, because if it's modifying the impact of your mutation and the nerves are then going to heal, nerve healing is very slow. So I would definitely try to stick it out in that study. I don't think there are a lot of studies going on, and it sounds like you're on, one of the clinical trials that's the most advanced. But for a study that's going to modify a genetic stressor, as this trial appears to be doing, and allows nerves to heal, then you have to allow at least 1 to 2 years for that nerve healing to go on. So don't give up yet on that. Then, let's see, we have orthopedic issues from Barbara with knees and back, had right knee replacements and fell 4 weeks post-op and tore the inner incision, quad tendon muscle. It's not uncommon for people with ataxia to develop orthopedic issues. And first of all, orthopedic issues are fairly common in the general population. But when you're dealing with ataxia and altered walking, altered balance, altered stress on your back, on your hips, on your knees, it could accelerate orthopedic issues that have nothing to do with the nervous system. And, many times if it's a significant orthopedic issue, you can get through a surgery like a knee replacement surgery. But, again, if you're at risk to fall, as Barbara did, falling, a month after, surgery, tore the inner incision, disrupted the area that had been part of the original surgery. I'm wondering if they're, if that's not going to be able to be corrected and heal up properly, if that is then going to add to the walking problem. So if I had to guess, what would be the next treatment that gets approved? The FDA has gotten more relaxed about analyzing and ultimately approving orphan drugs for rare diseases. Look at the recent drugs that have been approved for ALS and for Alzheimer's disease, with study results and criteria for approval that 10 years ago would never have been approved. I think the FDA is becoming more knowledgeable about biomarkers. And if you see an improvement in a chemical factor in somebody in a clinical trial with Alzheimer's, that is a good sign that the drug is going to be helpful and could be reason to approve it. So I'm hoping that many of the drugs in the pipeline, will make it across the finish line with the FDA. I think the one that is the closest now is troriluzole from the Biohaven company. And, we'll have to wait the next few months to see how that turns out. Then Sylvia, again with the GAD65, talked about the plasmapheresis. We talked about, finding a hidden cancer that could be behind it. We talked about intravenous immunoglobulin. Rituximab is a chemotherapy agent that blocks the production of antibodies. It doesn't affect the rest of the immune system, but it does reduce the production of antibodies and can be used in any autoimmune disorder that affects the cerebellum. So, again, you have to work closely with your physician, your neurologist, your hematologist, about using these agents. Okay, then Vina, any medication that helps with the symptoms of SCA1, tremors and balance issues. And like I say, the National Ataxia Foundation has a good list on their website of medications that can be used for tremor, medications that can be used for balance. The ones that are recognized by the American Academy of Neurology, riluzole and dalfampridine. But there are many medications used for all types of tremor that could be applied in SCA1. And for balance, physical therapy is still the best thing to be done. Now, Nadia has a question. I'm 40, I have idiopathic ataxia, no pain or severe symptoms. Is there a medication to prevent or lessen future progression? So with an undiagnosed ataxia, number one, it's important that you get involved with donating a blood or saliva sample for DNA analysis to the Undiagnosed Ataxia Project, which is national, could be international by now. And the National Ataxia Foundation can connect you with one of the labs that would receive a sample and then include you in the analysis looking for new genetic factors or new ataxia genes. Now, if you have something that is causing a progressive decline in the function of the cerebellum, potentially progressive atrophy of the cerebellum, most people look at the literature for aging, that many of the supplements and strategies used to slow brain aging, for us older folks, could be neuroprotective when used for somebody with a genetic or an as yet undiagnosed progressive cerebellar problem. So again, exercise, cardio, is known to have neuroprotective effects. of the supplements out there, the anti-aging supplements. There are many, many on the web, and you can't turn on the radio without hearing about a brand new drug for the aging brain. But I think the omega fish oil group does have a track record in protecting nerves involved in brain aging, as well as a healthy diet, a good exercise program. Then, let's see. Dean has an interesting observation about taurine helping to extend life, and apparently saw this in a BBC News article and mentioned that it seemed to have a positive effect in mitochondrial functioning. I have heard about taurine being used as a supplement. It's not at the top of the list of supplements, but I think you'll find that in many of the preparations that you can buy that are for the brain, for ataxia or for other neurologic problems, taurine might be a component. And again, as with any supplement, if you're going to be starting a nutritional supplement or an herbal supplement, use it for 3 months, see if you feel any different on it. If not, most likely it's not going to be worth continuing with. Now, another anonymous person, I'm an 80-year-old woman with SCA6 and sleep problems. Any sleep meds which are safe to take? So it depends what kind of sleep problem you're having. If it's insomnia, trouble falling asleep or waking up frequently at night, that's not due to obstructive sleep apnea or a breathing problem, then probably the safest thing to take is melatonin. Either immediate release melatonin, or there's an extended release that will help with frequent awakenings during the night. Most people who take it do not feel doped by it, so that if they have to get up in the middle of the night to use the restroom, it's not like taking a sedative, which would make their balance worse. So I think that's probably the safest one to try. But again, it's important, if you have a sleep problem, make sure it's not sleep apnea or a sleep breathing problem. Make sure it's not restless legs or periodic leg movements of sleep, which can disturb your sleep. And make sure you're not having what's called REM sleep disorder, where you talk in your sleep, you act out dreams. All of these can, cause sleep problems, leaving you not rested the next day. And they all have different approaches for treatment. Now, Cashin has a question about the son, age 17, diagnosed with spinocerebellar ataxia type 3, and have a question about strengthening his legs. Herbal supplements, apparently using, no vision problems, although vision changes are common in SCA3, specifically double vision. Not everybody gets it, but if it does occur, it is usually treated with special eyeglasses and sometimes eye surgeries. But the best way to strengthen the legs is with non-fatiguing exercise. You can do resistive exercise, you can do repetitive exercise on a peddler, and it's important, again, to not just look to medications or supplements, but to look at what physical therapy can do as well. Anne has an immune-mediated celiac ataxia, which we've heard about often. Taking Xanax daily for vertigo. So the Xanax is in the Valium family. It's a short-acting member of that family, which means it doesn't stay in your system very long. So I would wonder about your vertigo. Is it, you'll have episodes of vertigo for an hour or so in the morning, you can take a Xanax and then it's gone for the rest of the day. I would not recommend taking Xanax on a daily basis or multiple times over the course of the day, because it can affect your memory and thinking. So it has to be used very, very carefully. And then another question, how are Purkinje neurons related to GABA? and will a strict adherence, see, I just lost the note there. So GABA is one of the neurotransmitters that's involved in the pathways that control ataxia. And there are drugs in the pipeline and treatments that work on those GABA-related pathways. But GABA supplements probably don't get into the brain to any significant amount. So let me go back to one or two of the earlier questions in the time we have left. Okay, so Lawrence has a question about testing that's needed to determine if you have an immune-mediated ataxia, something in the immune system that's making an antibody that's attacking the cerebellum. So during his workup, that led to possible unknown ataxia, possible immune-mediated ataxia. He did have a positive anti-nuclear antibody, ANA, which is a general test. It's positive in lupus. It's positive as a marker for other autoimmune inflammatory disorders. But it looks like the rheumatologist didn't think that it was, a significant factor of its own. However, since then, it looks like the immune studies have gone further. Different antibodies, not the ANA, but other antibodies for primary Sjogren's disease. So it looks like you're still undergoing genetic assessments. Certainly, the rheumatologic disorders can affect the nervous system, but I think it's important not to assume that something that is primarily a rheumatologic illness affecting joints or, the skin, for instance, is going to be the primary cause of your ataxia. So, I would continue to follow up with a neurologist who knows, the spinocerebellar ataxias and the research going on. And then Yusuf has a question about frequent urination. Very common in the ataxias. The bladder needs to be coordinated like any other muscle in the body. So that, frequent urination, trouble controlling urination, and sometimes, slowing of urination when, the bladder muscles themselves just are not functioning properly. So fairly common. There are good medications and, better and better and newer ones that have fewer side effects than some of the older ones. But used in modest dose carefully, they can, alter some of those urologic symptoms. And, Botox treatments for the bladder have also been used to help with severe bladder irritability. And then I think we have time for one more question from Katie. Are there potential treatments for my adopted daughter with no genetic background? She's 35 and hasn't had her own genetic testing done. Balance, tiredness, poor handwriting. She's young. The odds are good it's a genetic factor. I would pursue genetic testing with a good neurogeneticist. And I apologize if I skipped over some questions or couldn't completely answer. I've made some notes here about things I want to look up further, and I will get back to Lori about those.
Thank you so much, Dr. Perlman. We had so many good questions again.
Oh, they were excellent. Very good questions. And yes. I wish we had answers for all of them. Some of them we just don't have answers for yet.
Right. Well, you provided so many helpful responses, and we're getting that kind of feedback in the chat here. So I hope you get a chance to check out some of that great feedback, Dr. Perlman. That is all we have time for today, everyone. A recording of today's session will be available on our website. We truly appreciate you all for joining us for today's session. And thank you all, and take care and stay safe, everyone.
Bye-bye.
Bye-bye.